Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera. The best preparation for tomorrow is the right use of today by Derry D. Ladies and gentlemen, the SARS-CoV-2 pandemic taught us that preparation today is true of paramount importance in dealing with the problems of tomorrow. Our previous experiences with SARS and the MERS-CoV epidemics serve us well in planning our subsequent responses. Our services and manpower were stretched in dealing with this COVID pandemic. Physician-led services in combating this virus were required in almost every corner of the country. In addition to COVID, the Ministry of Health also had to look into dealing with these non-COVID services and ensure that they were not left out. Non-communicable diseases, if not properly addressed, had the potential of resulting in increased mortality as well as overloading the healthcare facilities after the waning of the pandemic. The stress that was placed upon the healthcare system taught us that we truly need more physicians. We need physicians who can cater to the needs of the country. Physicians who can cater to the needs of the patients usually require a multidisciplinary approach to their multifaceted problem. Physicians who can handle a patient holistically and not just restrict themselves to their niche domain or areas of specialty. Ladies and gentlemen, clinicians based in Malaysian hospitals are seeing and managing ever greater numbers of patients who present with acute complex care needs which do not necessarily fall exclusively into a particular subspecialty. However, there are a number of occurrences where the subspecialty medical workforce did not manage to address the needs accordingly due to their limited expertise in the particular area. Such occurrences could lead to misperceptions on problems faced by patients as well as medical needs of the Malaysians. As such, it would be best for these complex, undifferentiated patients with COVID to be left under the care of clinicians with different general skills instead of those specialized in single-system pathology. A clinician with more general skills and an ability to work in a multidisciplinary team is critical to serving the needs of the country. Ladies and gentlemen, the future of general medicine or advanced acute internal medicine in Malaysia and other countries like the UK and Australia has received a lot of exposure in recent years. We have the advantage that we can learn from the experiences of the healthcare systems in these countries. While they may serve different populations, many parallels can be drawn between us and them. It remains difficult to define the exact patient population best catered by this versatile specialty, which is probably a pleasantly reassuring testament to the wide range of the specialty. This also means that the potential for AAIM to be used to great effect in solving perennial hospital issues like patient access block or even over the investigation in patients has yet to be utilized. Hospitals like Hospital Tuanku are representative of many of the smaller hospitals. I aim to ensure that we can train as many AAIM physicians to serve these areas where the care is truly needed. AAIM subspecialists will be a game changer for our local hospitals. Due to their extremely wide scope, they will be guided to develop one-stop physician-led services which will dramatically improve the level of care being delivered to patients by catering to some specialty services under one roof. For extremely niche input, the patients can be referred to the relevant specialties. MIMUS, Malaysian Advanced Acute Internal Medicine and Ultrasound Society, in keeping with the changing landscape of COVID, had pioneered a unique online ultrasound and echocardiography course that combined online teaching in the form of interactive webinars and local hands-on training from trained supervisors within local hospital setup itself. This was an especially opportune moment since the movement and gathering restrictions made previous methods of teaching in big conferences or meetings impossible and even dangerous. Yet the course of training our physicians in these critically important skills had to be continued. I'm happy to note that the first phase of the course was a resounding success and was heavily oversubscribed. It had been received interest from physicians outside of the government sector and even from other countries like Singapore and Brunei. At this juncture, I appreciate the cooperation of the Ministry of Health and Newcastle University Medicine Malaysia in helping to champion the cause and spread awareness of this fledgling specialty to all doctors, including the budding ones who will be the doctors of tomorrow. Thank you very much. Wabillahi taufiq wa hidayah. Assalamualaikum warahmatullahi wabarakatuh.